tachycardia, which we will discuss probably next week. Okay? One is AVNRT, which stands for AV nodal reentrant tachycardia. That's because in the AV node, there are two pathways in the AV node. Okay? And there's also what's called AVRT, or AV reentrant tachycardia. And that's because of the accessory pathway that was shown there. Okay? The accessory pathway that was shown in this diagram there. This accessory pathway, what's this called? Again? Bundle of Yes. This one has a nice name. Bundle of Kent. Kent, as in Clark Kent of Superman. Yes, okay? That's the name of the accessory pathway. It's called the Bundle of Kent. Okay, the bundle. So you have the bundle is, which is normal, and an abnormal pathway called the bundle of Kent. Okay, so those are the two. Those are the major considerations you have for supraventricular tachycardia. Just going over this normally before we adjourn. Okay, so remember that impulses are conducted abnormally between the atria and the ventricles, usually at a rate over 100 beats per minute. The hallmark, as I mentioned, is an abnormal conduction pathway through a re-entry circuit, or a circular conduction pathway, as in the case of AVNRT. Re-entry circuits formed by two pathways that are connected in their upper and lower ends, therefore an interrupted circuit for impulse conduction. So before I end this for today, let me just show you on this video. So remember that there's an accessory. There you have it, right? There it is. So you have the accessory pathway. The problem with the accessory pathway is because it does not have the complex. Remember, was it discussed how the AV node slows down conduction? It was discussed, right? Because remember, there's a lot of the myofibrils, right? Bigger. There's a lot of fibrous tissue which slows conduction down. Okay? So, an accessory pathway does not have the same characteristic as an AV node. It does not have those special characteristics that gives the AV node the ability to slow down the depolarization for 0.16 seconds. And because this one has no ability to slow down, what happens? Current will pass through it and depolarize the ventricles before the AV node ends. And that's what causes the tachycardia. And when you say re-entry, what happens? Sometimes what happens is the AV node will discharge, but the depolarization comes around here. But remember, there's an accessory pathway that's open here. So as soon as depolarization comes here, it will then go back into the atrium, go back into the AV node, and then just keep going back, 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 back. And this whole process, as I'm doing it, is what's causing the tachycardia. Okay? Does everyone more or less get what we're going to talk about on Tuesday? Okay? So we're going to talk about the specific mechanisms of how re-entry happens, and we're also going to talk about ventricular tachycardia before we go on to implantables. Okay? Any questions? By the way, before I go, okay, for those of you who are shy to ask questions in class, you can go to my page on Facebook. Go to my page on Facebook. You can actually message me there. Okay, I will answer within 24 hours. Okay, so that's the URL. Okay, or just search for France MP on the search bar on Facebook, and my page will is probably covered. Okay? By the way, some of the videos I've shown you are also posted on that page. Because these were the same videos I showed last year. Okay? So if you are resourceful, you can actually get the lectures that you class. Basically, it's always the same. Okay? Okay. See you again on Tuesday. Make sure that on Thursday, you don't waste your day. Okay? You start that day. A significant part of that day in studying or catching up on your reading. Okay? See you again.